Hi everybody and welcome to Survival Dads. So in this video I want to talk about surgical face masks. Now these are really popular, especially with the coronavirus problem which is happening worldwide currently. So I just wanted to do a quick video on some do's and don'ts and a little bit about why they can be useful. So a surgical mask is ineffective against airborne infection, but it can provide protection against splashes of blood and other bodily fluids to the face and into the mouth and nose. So if you feel you may have symptoms, it may be worthwhile you wearing this to protect other people from splashes of saliva and such like. And also it can protect you the same way. A really good thing about a surgical mask as well is it kind of reminds you not to touch your face, so it's a good habit to get into. Obviously you don't touch the mask when you're wearing it, so it kind of reminds you not to touch your face in that respect. So here are some do's and don'ts. So make sure that you wear your mask to protect yourself from infectious droplets that may occur when patients or yourself cough, sneeze, laugh or talk. You should always check to make sure the mask has no defects, such as a tear or a torn strap or ear loop. You should remove the mask when you're no longer in a clinical space or you are in a safe area, maybe away from other people. For the ear loop mask, you should always remove the mask from the side with your head tilted forward. For tied masks, remove by handling only the ties and untie the bottom tie followed by the top tie. Properly dispose of the mask by touching only the ear loops or the ties. Do not touch the front of the mask. So here are some don'ts. Do not use for protection against very small particles that float in the air. So like I said, this offers some protection from coronavirus, but it's definitely not a be-all end-all. If it gets wet or dirty, you need to remove it carefully and replace with a new one. If it's a tied mask, do not crisscross the ties. Obviously it gives you no protection if it's not actually covering your mouth and nose, so make sure you're wearing it correctly. These aren't to be reused, so you must dispose of them carefully after use. And as I mentioned earlier, do not touch the front of the mask. This area becomes contaminated in use. So hopefully this video was useful to you. Make sure you're out there staying safe and doing everything that you can to keep others safe. So thanks for watching, stay safe, and I'll see you soon.